Psychological testing or assessment, also known as psychometrics, is the systematic use of tests administered by psychologists to quantify human behavior, abilities, and aptitude, and to make predictions of their psychological performance. Psychologists use different tests and assessments to measure various aspects such as aptitude, personality, intelligence, and ability. An aptitude test is suitable when one intends to predict relatively distant future behavior like success in school. Similarly, achievement tests are used to evaluate a student's present academic or vocational skills. Career guidance counselors depend on ability and personality inventories, as well as mental aptitude tests. Psychological testing is crucial in various fields, used in clinical settings to diagnose behavior and mental illnesses. Businesses use psychometric assessments for employee selection. Researchers translate theoretical concepts into useful measures. Tests help understand a person's behavior and mental health. They identify strengths and weaknesses for better guidance. Tests measure current performance, not future potential. Conducted by licensed professionals in formal settings. Common in schools for academic and developmental assessments. Used by career counselors to determine vocational abilities. Characteristics of a good psychological test include validity, which is the degree to which a test actually measures what it purports to measure. In short, this is what validity means and is the primary requirement of any good psychological test. There are different kinds of validity, depending on the criteria of judgment employed by the person who draws inferences from a test. Types of validity. Types of validity: empirical validity, also known as statistical or predictive validity. It describes how closely scores on a test correlate with behavior as measured in other contexts. For example, a student's scores on a test of academic aptitude may be compared to their school grades. Predictive validity indicates how well a measure can predict future behavior. Content validity checks if the content is appropriate for what it intends to test. Face validity asks the question, does the test appear to be relevant to its end users? Construct validity measures if the test measures what it is supposed to measure. Reliability. A test is said to be reliable to the extent that it measures consistently. Types of reliability: test retest is used to test the consistency of the results when the same test is repeated on the same sample at different points of time. For example, testing for color blindness. Inter-rater reliability measures the degree of agreement between different people observing the same thing. For instance, a group of researchers observe and collect data on classroom behavior. It is important that all the researchers agree on how to categorize or rate the behavior. Parallel forms reliability measures the correlation between two equivalent variations of the test. It is used mainly when there are two assessment tools or sets of questions to measure the same thing. Internal consistency measures the correlation between multiple items in a test which are meant to measure the same thing. Personality tests. What is personality? In simple terms, personality is a combination of characteristics, behaviors, thought processes or cognitions, and emotion patterns of an individual. Every individual has a unique set of traits, which are innate characteristics and patterns that influence the way they behave, think, and experience emotions. Over a period of time, the individual is subconsciously guided by these patterns, which influence personal expectations, perceptions, attitudes, and values, among other things. The commonly agreed definition is that psychologists typically define personality as characteristic patterns of thought, feeling, and behavior. Sometimes we get confused between mood and personality. While mood is like daily weather which fluctuates, personality is like climate, it is more stable. People who interact regularly with an individual are able to predict how he or she may react in a certain situation. A behavioral element that describes personality, such as kind, outgoing, or impatient, is called a personality trait. The study of psychology is mainly about understanding people's behavior. Psychologists have put forward many theories to explain human behavior. Personality tests have been developed based on these theories. Personality tests are tools used by psychologists to assess human personality. These tests or assessments are techniques designed to measure the characteristic patterns of traits that an individual exhibits across various situations. Personality tests have a wider range of uses, including clinical diagnosis, guidance in therapeutic interventions, and also in organizations and industries in the process of employee selection. There are a number of methods through which psychologists seek to measure personality. The most common ones are objective tests and projective measures. Objective tests. An objective test, as the name suggests, uses objective methods and is not influenced by the examiner's own beliefs. This ensures freedom from rater's bias. Objective tests are a set of questions that are marked and compared against standardized scoring mechanisms, just like school exams are administered. Objective tests tend to have more validity than projective tests. However, they may still not be completely objective, as the report will depend on how accurately or honestly the individual taking the test answers the test. Self-reports are the most common objective tests. Self-reports are easier to administer and rely basically on the information provided directly by participants about themselves, their beliefs, etc., in a question and answer format. There are many different test formats, and each of these requires participants to provide information about their own personality. Self-reports are typically designed in multiple choice items or numbered scales representing a range from 1, strongly disagree, to 5, strongly agree. Self-report measures are used in clinical as well as non-clinical settings and have wide utility, including diagnostic purposes to helping with career guidance. We will briefly discuss some of the widely used personality self-report measures here: Myers-Briggs Type Indicator, NEO-PI-R, MMPI, MPI-2, 16PF, and Eysenck Personality Questionnaire. We will briefly discuss some of the widely used personality self-report measures here: Myers-Briggs Type Indicator, NEO-PI-R, MMPI-2, 16PF, and Eysenck Personality Questionnaire. Myers-Briggs Type Indicator. Based on Carl Jung's theory, it measures 4 bipolar dimensions: extroversion, introversion, sensing, intuition, thinking, feeling, and judging, perceiving. NEO-PI-R, based on the 5-factor model: openness, conscientiousness, extroversion, agreeableness, and neuroticism. MMPI, used for diagnosing personality disorders, it includes 567 true-false questions and measures 10 clinical scales. 16PF, based on Cattell's 16-factor theory used in therapy, planning, and career selection. Eysenck Personality Questionnaire measures psychoticism, extroversion, and neuroticism. These inventories help in understanding and assessing different personality traits. Projective measures. Unlike objective tests, projective measures are sensitive to the rater's or examiner's beliefs. Projective tests are based on Freudian psychoanalytic theories. The purpose of projective tests is to expose people's unconscious perceptions by using ambiguous stimuli. Thematic apperception measure and the Rorschach test are the most commonly used by mental health professionals. Projective tests are criticized for their poor reliability, they are very subjective, and their poor validity, lacking scientific evidence. Rorschach test. The Rorschach test consists of 10 ink blots. Participants are shown ink blots and asked what each one looks like. Based on the responses, the test administrator makes an interpretation of the participant's personality characteristics and emotional functioning, and is thought to measure unconscious attitudes and motivations. Thematic Apperception Test, TAT, consists of 30 cards of ambiguous drawings, 1 blank card. The test administrator asks the participant to tell a story about each picture, the background that led up to the story, and the thoughts and feelings of the characters. Similar to the Rorschach test, the results are thought to indicate a person's personality characteristics and emotional functioning. The Differential Aptitude Tests. DAT for guidance, which is essentially a profiling instrument, assesses 8 different types of ability or aptitude required for success in different areas of employment. The differential aptitude tests assess 8 abilities for success in various careers. These include verbal, numerical, and abstract reasoning, perceptual speed, mechanical reasoning, space relations, spelling, and language usage. Developed by Bennett, Seashore, and Westman, the DAT is used in educational and vocational counseling. It is easy to administer and interpret. The battery includes tests like verbal reasoning, numerical ability, and abstract reasoning. Special aptitude tests measure mechanical, clerical, artistic, and professional aptitudes. Examples include NEAT, GMAT, and G. Scholastic aptitude tests measure academic aptitudes like the SAT and GRE. Uses of aptitude tests. Firstly, these tests are a means to predict future success both in educational and vocational careers. Secondly, students can get a better understanding of their aptitudes from these tests, which helps in making a proper choice of courses, subjects, and careers. Thirdly, they supplement other psychological tests. Fourthly, aptitude tests give an insight into strengths and weaknesses. Once identified, individuals can work towards improvement in areas in which they may be lacking. Lastly, they are used by universities in the admission process and selection of students in colleges and technical institutions. Interest tests. An interest can be described as a subjective attitude of an individual that motivates him or her to perform a certain task that gives pleasure and satisfaction to the individual. In other words, if an individual is interested in something, there is a natural curiosity about the object or activity, and he or she is enthusiastic about it and is also willing to face difficulties while engaged in the task. There is a notable change in behavior. The person is more attentive and more immersed in the activity. Understanding the level of interest of an individual is an important aspect of career counselling. This is measured by the various interest inventories that are available for this purpose. There are various testing methods such as direct observation of behavior, ability tests, and self-reporting inventories of interest in educational, social, recreational, and vocational activities. Typically, the activities represented in interest inventories are related to occupational areas, and these tests and their reports are used in vocational guidance. Types of tools for measuring interest include Types of tools for measuring interest. Formal methods include standardized interest inventories and interest test batteries. Informal methods encompass self-reports, records of activities, and observations by others. Notable formal methods include the Strong Vocational Interest Blank, CUDA Preference Record, and Thurston's Vocational Interest Schedule. The Strong Vocational Interest Blank, designed by Professor Strong, includes 400 items rated on a 3-point scale. It reports interest maturity, masculinity, femininity, and occupational level. The CUDA Preference Record by G. Frederick CUDA covers 9 occupational scales. Thurston's Vocational Interest Schedule identified 8 factors of interest through factor analysis. Note that some tests measure ability rather than interest. Limitation of interest inventories. Some of these tests measure ability rather than interest. Interests are not permanent and keep changing. The accuracy of the test is questionable as the reports are based only on inputs from the participants. The questions relate to certain types of activities but do not lead to clear-cut vocations. Despite these limitations, interest inventories are very useful in determining the future trends of an individual's vocational life. Interpretation and analysis of tests. Test interpretation has not received a great deal of scientific scrutiny. Here we will explore some approaches to assessment and interpretation to understand how a skilled psychologist prepares for and delivers an interpretation. One such approach is computer test interpretation. Computer test interpretation. 3 decades ago, computer programs for test interpretations were developed in vocational interest measurements. This now includes personality tests and psychological diagnoses. Programs compare test results with normative data to determine score ranges. They choose relevant phrases from a library and organize them into a narrative summary. The summary can be printed or displayed on a computer. Some interpretations are more elaborate and provide normative interpretations. For example, your score on the introversion scale is in the normal range. Some interpretations explain the meaning of scores and terms like introversion and extroversion. Some programs suggest implications for future behavior. For example, people with similar introversion scores tend to avoid conflict. They may enjoy social interactions but need time to recharge afterward. They may be uncomfortable in social interactions with the opposite sex. They form relationships slowly but tend to be highly stable. Evaluating the validity and reliability of these interpretations is expensive, so most psychologists do not undertake it. Self-interpreting tests. Self-administering self-scoring. Self-interpreting tests such as the Allport-Vernon-Lindsay study of values, personality tests, and John Holland's self-directed search, vocational interest inventory, are now widely used in assessing constructs of interest in vocational psychology. These are incorporated into computer-based guidance programs such as SIRI and personality tests such as the Neuroticism, Extroversion, Openness Personality Inventory, revised NEOPIR. Despite many concerns about the possibility of examinees making mistakes in scoring their tests, some modifications of the tests have reduced these problems to an acceptable level. Understanding the assessment results. The test scores or results have to be interpreted and discussed with the client. Test scores are a statistical summarization of statements made by the client in responding to test items. Psychologists may ask the client to elaborate on some of their responses to the test during a face-to-face interview, focusing on contradictory statements. Low scores can be threatening or embarrassing to clients and need careful consideration. Nomothetic, norm-based, and ideographic, individual-focused approaches are mainly used to understand the meaning of the test results. Nomothetic approaches are quantitative. They compare an individual's score to a relevant comparison group. For example, grades of students from the same grade can be compared. This helps the psychologist to distinguish average or typical scores from various types of exceptional scores. Psychometric testing is consistent with a nomothetic approach to test interpretation. The ideographic approach focuses exclusively on the individual. Case studies, informal interviews, unstructured observation, and other qualitative methods are ideographic approaches. The assessment of vocational interests uses ideographic approaches. Career counselors want to compare an individual's interests and abilities with those of a reference group. They also need to compare each interest and ability with other interests and abilities of the person. The integration of results. Counselors and psychologists are required to integrate their understanding of the test results with the other information available at hand. Comments of others about the individual, work or school-based performance indicators, any other additional assessment results, family background, and any work history are all relevant information to be considered. Presentation order. Presentation order. There is no particular format for presenting the test results. However, it helps to consider an order in which to present the information. Counselors who are just beginning their career may consider starting with the interpretation that has concrete information, like achievement test results, and then move to information that is more abstract, such as personality test results. Usually, test results are discussed face-to-face, and with some experience, the counselor will be able to decide the best order to discuss the test results. It is important for the counselor to understand the emotional needs of the client during this process and consider whether the client is psychologically ready to think about the test results effectively and able to handle any threatening information constructively. Preparing the client. Though the counselor and client jointly agree on taking the tests, the counselor still needs to prepare the client for the interpretation. During the interview, when the counselor feels the client is ready, they can discuss the test results. It also helps to describe the test briefly so the client can associate the results with the test they took. Counselors also need to review with the client the types of information the test provides and the types of possible interpretation. For example, a score may indicate an interest in a particular occupation, but it does not mean the person has the ability to be successful in that occupation. Counselors should also explain to the client the inexact nature of test scores and the limits on the precision with which inferences can be drawn. Delivering the test interpretation. There are several possible interpretations to a given test score. Relate the results to the issues and decisions confronting the client. Test results indicate an approximate level, like an IQ range. Explain that test scores predict a range of outcomes. Avoid technical jargon. Use simple language. Convey meaningful information. Be aware of defensive reactions to low scores. Clients may impose judgmental reactions on themselves. Inform clients of the limited accuracy of scores. Discuss strengths and weaknesses to help clients make realistic plans. Encourage client participation during the session. Be sensitive when discussing weaknesses. Use plain language to explain test results. Client feedback is crucial for understanding. It gives insight into their attitudes and feelings. Encourage client participation by asking questions. Ask questions like, "Is this what you were expecting?" Aptitude tests measure skills or propensity for success. Aptitudes are related to vocational success. Intelligence and aptitude tests provide information about potential. The word aptitude means fitted for. Aptitude indicates potentialities. Understanding aptitude helps predict future capabilities. It combines innate capacities and developed skills. Aptitude can be developed through practice. It is a unique potential of an individual. Aptitude opens ways to interest and satisfaction in life. It connotes more than potential ability and performance. It is a present condition with a forward reference. There are many aptitude tests currently in use. We have general and special aptitude tests. Aptitude tests are categorized under DAT, DBDA, and special aptitude tests. Test profiles can be provided graphically. Visual representation helps clients understand test results. It clarifies and organizes the results. The test report with graphs can be given to the client. Encourage clients to take notes during the session. Self-estimation of scores helps understand interpretations. Discuss discrepancies between self-estimates and actual scores. This leads to useful discussions. Follow-up. A follow-up appointment is useful as it allows some time for the client to assimilate all the information provided. Clients should have an opportunity to clarify any doubts once they assimilate all information.